A warm welcome to today's talk, Tuesday the 8th of August. Now, the main thing I want to look at today is from the Committee on Oversight and Accountability in the United States, Select Subcommittee on the Coronavirus Pandemic, and they're currently investigating into potential overreach from the federal COVID-19 vaccine mandates and policies in various government departments. But before we do that, the eagle-eyed of you noticed a very interesting interaction. Now, this was in the Australian evidence that we looked at when Senator Matt Canavan was asking a question. And Pfizer Dr. 1, this is Dr. Theroux, who's the country medical director for Australia and New Zealand, got a very strange look from Dr. Hewitt, head of regulatory science. Now, was it that Dr. Theroux made a sudden, unexpected noise? Or was it that he said something that Dr. Hewitt thought was a bit strange? Let's watch the interaction now. Really quite fascinating.
Do you still believe that the COVID vaccine, your COVID vaccine, is a critical tool to help stop transmission?
Absolutely. It's a critical tool in preventing, as I said earlier.
So the question that Senator Canavan asked there, is the COVID vaccine, do you still believe the COVID vaccine was a critical tool to help stop transmission? And of course, it looks like Dr. Hewitt thinks it wasn't and was a bit surprised by Dr. Theroux's answer, which was later qualified. So well done, the eagle-eyed viewers out there. Must have been about 100 of you spotted that, and well done. Now, we want to go on and look at the Select Committee now on the coronavirus pandemic that's meeting up in the United States. Now, before we look at some pretty interesting video, let's just have a quick look at the background of what's going on here. This is the Select Committee on the Coronavirus Pandemic. Chairman is Dr. Brad Wenstrup, Ohio, but actually a physician himself, so in a good position to do this. Plenty of references there, all the primary sources. We always go back to the primary sources as far as we can. Committee on Oversight and Accountability. Investigation into overreaching federal COVID-19 vaccine mandates and policies at the Department of Defense, US Office of Personnel Management, Department of Labor, Department of Health and Human Services. So sort of a who's who of these government departments in the United States. Chairman Wenstrup is requesting access to all documents and communication and guidance. Let's hope that this is forthcoming. Other investigations have not got everything that they needed to make full adjudications. Utilised by these agencies to craft their coercive policies prior to forcing a novel vaccine that did not stop transmission of the virus. Tying up to the last video, of course. The last clip from Australia. This is according to the committee on millions of Americans. At the Select Subcommittee's hearing on vaccine mandates last week, expert witnesses highlighted the Biden administration's abuse of executive power and disregard for individual freedoms that resulted in employment termination, decreased military readiness, and increased distrust in public health authorities. The Select Committee is seeking further information from the various government departments regarding any political interference by the Biden White House and other outside organisations on federal COVID vaccine mandates. Now, clearly that's a highly political statement, but I do remember President Biden making this statement at the time, and I remember commenting. I said we can expect, or we can assume, the President of the United States is well informed, because he didn't just decide to say this on his own. He's read it from somewhere. So someone's given him this information. So let's look at it now. And this is a big reason why there's a huge lack of trust at the moment. The age of deference has well and truly passed. But over to the video now.
On June 21, 2021, President Biden stated, quote, "If you are vaccinated, you're not going to be hospitalized. You are not going to be in the intensive care unit. You are not going to die," end quote. Again, simply yes or no. By that date, were there vaccinated Americans that were hospitalized?
What I can tell you is at the time, CDC was releasing increasing data showing the immense protection of vaccines against severe disease, hospitalization, and death.
But by that date, were there vaccinated Americans that were hospitalized?
Maybe I will say this. We still, to this day, do not have data on people who are coming into the hospitals who are vaccinated. That is a data point that we have lacked.
Well, I appreciate you saying that, because that is another thing that we need to look into very closely and to do better going forward.
On our data system.
But I will say this, believe me, as a physician, I was watching what was going on. We were first looking out to try and see how do we treat this thing? What is going on? What blood work can we do? IL-6, your inflammatory markers, CT of the lungs. There were no tests. And we were trying to find answers, but we did pay very close attention to the trials of Operation Warp Speed. And it was fascinating to, be a part of that in some way. We would meet with Dr. Fauci, Dr. Collins, et cetera. But we knew from the trials that people that got vaccinated still got COVID. In general, they didn't get as sick, and they were less likely to be hospitalized, and therefore less likely to die. But it was still happening. So I'll ask you the question, to the best of your knowledge, had any passed away? When he made that statement in June of 2021.
If I might, Dr. Wenstrup, let me just also thank you for your work in promoting vaccination. Many videos of you doing vaccine clinics yourself. So I want to thank you for your efforts there. It was much, what I will say is my understanding of the initial clinical trials that were released in November, December, before I became CDC director, was 96% protection against symptomatic disease. In medicine, we never say never. But
exactly. Exactly. So thank you. And that's the problem I have with this statement from the leader of the free world, is to say something so definitive. You're not going to be hospitalized. Even in the trials, people were hospitalized. You're not going to the ICU as a definitive statement. That was misinformation. That was divisive. That was dangerous. And it put you in a very hard spot. It put you in a very hard spot, as you are to be the leading voice for America. And I applaud so many of the things that you have done and did do. But this is a problem, and that's the point I'm trying to make, that we cannot let this happen. We have to let science be the science. And in my opinion, we should have been hearing from the doctors who treated COVID patients, not politicians, not someone in the lab. So one more question. So just to be honest, we know the vaccination saved lives. We know it's not perfect, but there were breakthrough cases and there were deaths, and we have to do better going forward.
Interesting. So to say in June 2021, if you're vaccinated, you're not going to to be hospitalised, that was inaccurate. You're not going to be in the ITU, that was inaccurate. And you're not going to die, that was also inaccurate. Less likely that those things would happen, but certainly not definitive statements. So I'll leave you to decide if that is misinformation or disinformation. And for the director of the Centre for Disease Control to say we still don't have data on people going into the hospital who are vaccinated, why weren't these systems instigated, at least in pilot sites? How on earth are you going to do post-vaccine release surveillance if you don't collect this basic information? So definitive statements there, perhaps inappropriate at that time. And as I remember this at the time, I remember thinking the President of the United States will be well informed. Who told him to say this is an interesting question. Now, I'm just going to play one more clip that seems to show that Dr. Dr. Rochelle Walensky from the CDC was not quite on the same hymn sheet, shall we say, as the White House. Let's just look at that clip now briefly.
But I want to shift to the statement you made on February 3rd, 2021. You stated there is increasing data to suggest that schools can safely reopen, and that safe reopening does not suggest that teachers need to be vaccinated. Vaccinations of teachers is not a prerequisite for safely reopening schools, end quote. The same day, the White House stated that you were speaking in your personal capacity, quote, end quote, on personal capacity. So again, just yes or no, were you speaking in your personal capacity when you made that statement?
Whenever I have been speaking to Congress, to the media, at press conferences during my tenure at CDC, I have been speaking in my professional capacity.
Thank you. Was that your position based off the available science and your own knowledge and experience?
Just to be clear, there were limited amounts of vaccine doses at the time. There was a prioritization ultimately several weeks later for teachers to get vaccinated, but I didn't think teacher vaccination, if we had all of the other five layers of mitigation strategies available, that was not the only thing that needed to keep schools closed. That was, the schools could open without teachers being vaccinated. And there were data and literature, people in healthcare were working already.
Many people were
Yes,
working.
many people were working.
Why do you think the White House contradicted you then, or tried to change it from professional to personal?
That is something I can't speculate to. I think you'll have to ask them.
That's fair.
Interesting. So when Rochelle Walensky said that schools can reopen without teachers being vaccinated, she was speaking in her professional capacity as head of the CDC. When the White House said she was speaking in her personal capacity, that was simply wrong. She was speaking in her professional capacity. So rather strange goings on. Interesting now that this is starting to come to light. We've looked at the information coming out from the hearings in Australia and now in the United States, and I think we are starting to get some clarity and some transparency into what's going on. Now, it's fairly obvious there that Rochelle Walensky was trying to cooperate with the hearing, I think, regardless of what you think of her views, she was trying to cooperate. The Australian Senate going to allow the attitude of the Pfizer representatives to prevail, because in my view they were holding the Senate and the people of Australia thereby and the Senate with not in the full respect that I would like to have seen. I'm not saying that we're showing contempt, but not the full respect I would like to have seen. So what actions are the Australian Senate going to take on that? And of course we will be watching these hearings in the United States to see what further information comes out. And of course the key thing is now that the situation is completely changed. Now, way back in February 2021, we were in very early waves of the pandemic. Now things are in a completely different situation. The risk-benefit analysis is completely different now to what it was then. And I think current policymakers need to be aware and cognizant of that. So interesting things to come out. Let's hope that these have really positive benefits for the future. Because kind of who did what when, in a sense, okay, it matters. We need accountability, especially at higher political levels. We need accountability. At official levels, we need accountability. I wouldn't get away with making big mistakes at work. I don't see why other people like that should. But primarily, we need to learn for the future. We need to get this right next time, because make no mistake, the next pandemic could be way more deadly. The next major threat to public health could be way more deadly. And we need an agile, localized response to that, I believe. We'll leave that there for now, but thank you for watching.